Are you suffering from allergies? That's probably a dumb question, right? I know a lot of us certainly do. While spring and summer brings on warmer temperatures, longer days, the blooming foliage, it can also bring on seasonal allergies for many of us. According to the Asthma and Allergy Foundation of America, more than 50 million Americans experience various types of allergies every year. We're going to speak with just down the road, she's in Plant City. Joining us today is Dr. Mishra. She's a family medicine physician with Optum. She's here to talk about seasonal allergies and how we can manage them and some kind of natural alternatives, foods that you can eat that will help your allergies. We're ready to learn today. Good morning, Dr. Mishra.
Good morning. How are you?
I'm fabulous. How are you?
I'm doing good, thank you.
Well, a lot of us have allergies this time of year, and sometimes when we get them so bad, Dr. Mishra, we think we're getting a cold, or people around us, we're sneezing, we're sniffling, we're blowing our nose, our throats are scratchy. It happens to a lot of people, doesn't it?
Yes, it does. A lot of people in and around here in Tampa, especially in Florida, we do get a lot of allergies, and depending on, the warmth, it's higher around here because, like you said, the warm temperatures and the humidity makes it worse. So, yes, we do.
Yeah. So what are some of the causes of seasonal allergies that you can share with us?
So it depends on season, various seasons. So in spring, it's mostly pollen, especially oak pollen. And in fall, it tends to be like weeds, ragweeds, grass, pollen, and stuff like that. In winter, it tends to be the molds and the spores of the molds. Wow. Yeah. Dust is another issue, though we have less of it because of the, vegetation. It's better. It's a bigger problem in drier areas. But most of these are seasonal, and the allergens vary according to season with whatever we get in those months.
Mm-hmm. You mentioned mold in the winter. Is that because we turn our heat on sometimes and those mold spores have been sitting there for a while and then they get released?
Yes, they do. Oh. They get released into the air once we start the heating, and then they get the humidity. We are humid all the time, regardless of the season. So they get the humidity. Once they get the water, these dry spores become more wet, moist, and bigger, and they can cause allergies, bigger response in the body.
Yeah, absolutely. Yes. We're going to get to some foods that can actually help. I know in Florida, and you mentioned it, I did a little research last night knowing that you were going to be on this morning. Like you said, Florida, it's ragweed in the spring, mold in the fall. What are some of the common symptoms of seasonal allergies? And give us a few that maybe we don't even realize that it's part of our allergy, our own immune response with our bodies.
Yes. So, starting with the upper respiratory, we can get runny nose, sneezing, scratchy throat, cough. Mostly you see late night, or cough that starts during the early morning whenever the discharge starts to come down, like the post-nasal discharge starts to come down into your throat. It evokes a cough also. So people confuse a lot of the times. They say, I'm having an infection because I'm coughing. Mm-hmm. I have a cough in the lungs. A lot of the times it tends to be allergies. And it can be treated, or it can be controlled by controlling the allergies better. Mm-hmm. Also, you can have a lot of sinus pressure that can lead to sinus infections. So people that have recurrent sinus infections, they are actually having underlying allergies, which people don't realize. They just say, I get sinus infections every year. Well, it is because you have underlying allergies, which causes the sinuses to be filled constantly, and then they get infected. If you don't treat the allergies, then you will keep getting these infections. Okay. So those are the upper respiratory problems. Then coming down to, lower respiratory or lungs, we can get cough, which is actually, asthma is sort of a form of allergy. We can't technically call it allergies because there are other reasons for asthma too, but asthma is also a form of allergy, so that can happen as well. Skin reactions can happen with what we call as urticaria, and that can happen due to food, that can happen due to seasonal allergies, but itching, scratching skin with various kinds of rashes can happen as well. Not profound, but some people say, oh, I itch all the time, I don't see any rashes. That could be a manifestation of allergies as well. Eyes are also affected a lot.
Oh, yeah.
So constant runny eyes, itchy eyes, pain, burning can also be signs of allergies as well.
Wow, I know a lot of us experience here in Southwest Florida. When you say sinus infection, so a sinus infection is completely different from allergies. They're two different things, right?
Yes. Okay, I'm going to give a little bit of explanation to this. So sinus infection can happen either in people that have chronic allergies, like ongoing allergies, or they can happen as a response after a cold. Okay, so basically why it happens is our sinuses are filled with air, but whenever, for whatever reason, they get filled in with fluid and cause pressure, then the bacteria that lives inside our throat, which are normal and nice bacteria, they're helpful bacteria, they find a good way to grow inside the sinuses. And that causes the sinus infection and drainage, pressure, all of that. So it can happen when you get a cold, and then after 10 days, it goes on to become, because your sinuses are now filled with a lot of fluid that the bacteria attacks. But people who have allergies, their sinuses are constantly draining because they continue to pour in. You know, the sinuses are draining into our nose. So whenever our nose is congested, the sinuses also get congested and get full of fluids. And that's a beautiful medium for the bacteria to grow and cause the sinus infections. So people that say that they have sinus infections consistently, not once in a while or so, but say every spring I get these sinus infections once or twice or 3 times, that's a sign that they have underlying allergies that are being untreated, which is leading to filling of these sinuses, then subsequently getting infected.
Wow, you explain it so perfectly. Thank you so much. I'm learning so much. Hope you are too. If you're joining us for the first time this hour, welcome to the Midweek Mix. We're speaking with Dr. Mishra. She's a family medicine physician with Optum. She's just down the road in Plant City, and we're talking about chronic conditions, you know, allergies, asthma, things that come around this time of year. Of course, spring and summer brings that. How do you feel about a neti pot? Do you feel that kind of can cleanse the sinuses?
Neti pot is, it helps. Okay. And what it does basically is it opens the sinus openings. So people think that it goes into the sinuses, but it doesn't. It actually opens up those tiny openings that of the sinuses which drain. So once the openings are up and the congestion at that opening is down, sinuses start draining into the throat and into the nose, which after neti pot we should always be blowing our nose so that in order to get the drainage out. The more drainage we get out, the less chance of getting infections down the road. They don't cure allergies because allergies are a more, underlying effect. They are more like a symptomatic treatment, but an important symptomatic treatment, because without the neti pot or cleaning, not just neti pot, but you have the saline sprays that we have over the counter, they can help bring down the congestion and avoid complications that arise from the allergies.
Yeah, and for those that may not know what a neti pot is, it's just a little pot that you put some kind of lukewarm, warm water, and you mix some salt with it. And you correct me if I'm wrong, Dr. Mishra. And then you lean over a sink and you just pour it through your nose, and it goes through the other, and it comes out the other nostril. It's very cleansing. I enjoy doing it. I know a lot of people are a little afraid of it. It might make you cry a little bit, but it really is cleansing. I enjoy doing it a lot.
Yeah, it's a matter of habit. Initially, it might feel uncomfortable, but once you get used to it, you'll feel that cleansing. Like you said, it kind of drains all of that out, and a lot of pressure comes down whenever you start doing that, because the sinus is draining out. The sinus pressure and the headaches also decrease with the neti pot.
Yeah, for our listeners, if you've never done it, I'm sure, Dr. Mishra, you back me up. I encourage everybody to do it. It's a really cool little thing. You can just grab it at Walmart, Walgreens, CVS. It's not very expensive either. So what other kinds of preventive measures or treatments are available for these seasonal allergies that drive us crazy?
Right, that's true. So it is based on how bad the symptoms are. So for mild symptoms, that happens, I have allergies just now, but it gets better in a few days or so. Once the rains are up and I get those symptoms, the rains are down, it's better. In that case, we go for over-the-counter things like the Zyrtec, Claritin. Take it for like 7 days and then stop. And things are okay, you don't need to do anything. It's symptom-wise. Whenever your symptoms happen, you take it. Mm-hmm. The next approach is people that have more consistent runny nose, sore throat, and scratchy throat or eyes. You can have the nasal spray, that is the Flonase over-the-counter, or stronger prescription, nasal steroids, the sprays, that help in decreasing congestion and inflammation over a long period of time. These are more like preventive medications. They decrease the congestion, they decrease the swelling inside, and they decrease the overall drainage. The third ones are what we call as singular, or singular-like medications. They're also a preventive. They're mild, but they help in addition to the nasal steroids. And they can be taken consistently. I don't advocate to take the Zyrtec, Claritin, or fexofenadine-like medications on a regular basis. Why? Because our body gets used to them, and after a certain time, they stop working. But if you take it on an inconsistent basis, they work very well. So it works initially, but if you keep taking them, they lose their potency. So for people that have ongoing allergies, I usually say keep your nasal steroids constant, over the season, say 3 months over the spring season. And for bad days, take the Zyrtec or the Claritin for 7 days and then stop. That works better.
This is wonderful, learning so much with Dr. Mishra, family medicine physician with Optum, and we're talking about allergy season. Yeah, you are just a wealth of information. What are some, we're going to take a break in just a second, but before we do that, what are some specific seasonal triggers? Can you help us avoid those? Are we doing anything that's causing us to get allergies more? Can you help us?
Sure. Usually, they are in the environment, so you can't avoid going out or going to work, going to school, all of that. Mask is one way, but that's a little crude way, I would say. The other things that we can do is, while we are inside the houses, we can use good air filters and servicing our ACs on a consistent basis to avoid molds. Our air filter should be working very well.
Yep.
When it's, oak season, you can try to shield those pollens as much as possible. Cleaning the house, cleaning carpeting is very, very important because most of the houses that have carpets, if they're not cleaned properly, then they can be a cause of a lot of allergies. So those are some of the things that we can do. When it comes to pollens and grass, you can't avoid them. They are there. But in that case, you can take the medication in order to avoid or prevent the seasonal allergies for those. How we can know if most of the times, from a economic point of view, we say go for the medication. If it works, it works. Don't even worry about it. But if it doesn't work, our approach doesn't work for controlling the allergies, what we say is let's do a test and see what you're allergic to, okay? And then once we know what the triggers are, because there are two ways of doing it. One is a skin test or a patch test, and then the second one is a blood test. Both of those are pretty effective. So once we know what the triggers are specific, if for person specific triggers are. Then we can try to avoid and do a better job of that, depending on the allergen, of course. And then, if needed, there are medications like allergy shots, which are geared towards decreasing someone's response towards the specific allergen.
Excellent. Dr. Mishra, you are amazing. We're going to take our first break. And just one more question on the other side, and we will wrap up. Thank you so much for your time. Can you stick around for just a moment?
Sure. Thank you very much.
Yeah, thank you. Learning so much about seasonal allergies. Dr. Mishra is our guest. We'll take our first break for the Midweek Mix. It's about 9:25 on this beautiful Wednesday. We'll be right back here on your information station, WENG. And we're back on the Midweek Mix. It's about 9:28. Dr. Mishra, thank you so much for all the wonderful information. Where can our listeners go for more information and resources about what we talked about today?
We can go to WebMD or patient portals on some, like Mayo Clinic. Those have very good information about how to manage your allergies and what are the triggers, what things you can do. Those are good. Two of the ones that I really like are the WebMD and the Mayo Clinic.
Okay, great. And we just got about a minute before we need to go. But tell me, you actually are a family medicine physician with Optum, located in Plant City. What is Optum?
Yes.
Never heard of that. Tell us about it.
So Optum is, we are a corporate of several clinics spread throughout the area in Hillsborough and Pinellas counties.
Okay.
Actually, more than that, also in Orlando area.
Okay.
And we are mostly family medicine clinics, or medicine, internal and family medicine clinic. And our headquarters is in, for the region, is in Pinellas County.
Okay.
We see patients mostly Humana, Care Plus, and other risk management patients who are like, Medicare Advantage patients mostly.
Okay.
Medicare and Medicare Advantage patients. Most of our patients are elderly and, sort of in the more of the sick category, I would say.
Okay.
And we are located all over, and my clinic in particular is in Plant City.
Okay.
So
great.
Yeah.
We got to go. Thank you so much, Dr. Mishra. You were just a wealth of information. Really appreciate it. You have a wonderful day.
You too. Thank you very much for having me.
Yeah, take care.